Hi John, what do you recommend medical students in Holland?
That's a really big question. Probably pretty much what I'd recommend to medical students anywhere. And that is to first recognize that the medical education in medical schools around the world right now is based upon what we thought worked and what we thought was useful to know as a physician about 50 years ago. The amount of change in medical education has been somewhat pathetic. It's been focused on the hard science of specific diseases rather than looking much more holistically at the whole life of a person, because we're realizing more and more that the social determinants of health and there's many other factors that affect the health of an individual have not really been addressed adequately in medical school at all. So the way I like to think of it is, you are a member of the sci-fi, the science fiction generation. You have access to tools that none of the generations of physicians before you had access to. You have access to knowledge about the breadth and depth of how the entire life of an individual is determined by much more than just the pills that you hand them or the procedures that you do on them. And so you have to break out, as the sci-fi generation, you really need to break out of your grandmother and your grandfather's medical school and realize that while the knowledge you get in that training is indispensable, it is woefully insufficient to really understand how to change health at scale. And so to the extent that you really try and embrace the exponential technologies that are emerging across the world, and the Netherlands is a real hotbed for innovation right now, and so there's plenty going on there, that you have the opportunity as a medical student to take the exponential technologies, take the information about how those can apply to an entire community at scale. Consider your role very differently than that of the physician in charge of a particular department in the hospital or in a clinic, but as someone who can catalyze and inspire broader teams, not just within the healthcare community, but throughout the entire community, in the school system, in the social services, and bring about much more coordination across the entire richness and life of an individual. So the healthcare education, the medical school education of today, with rare instances, is very little change from what it was 50 years ago. And so if I were a medical student today, I would be pretty disruptive. I'm not recommending that everybody become disruptive to the point where they can't take advantage of what is offered by the traditional medical school, but to the point where they demand a broader focus on the health issues from a community perspective and from a social determinants of health perspective and from a behavioral and motivational perspective, because we know that just giving people information that not smoking and not drinking and following the regimen for their diabetes is totally inadequate to get them to change their lifestyle. And we need to have much more in the way of motivational tools and learning tools that help meet people where they live and address the problems that are unique to them. And we need to personalize the motivation and personalize the education of those that were responsible for healing in a much broader personal and community context. So don't take what you get as the right education today, because we know so much more than we did in the past, and we are on the cusp of changing it. So the current generation of medical students are going to be the ones that transform healthcare education. It won't be the faculty nearly as much as it is the students themselves. So I would encourage you to have fun, be disruptive, and demand nothing less than what you know to be true.
Okay, thank you so much.
My pleasure.